As climate change causes temperatures to rise across the globe, heat-related deaths are surging too, increasing 23% since the 1990s to reach 546,000 annually. Those figures come from a new report published on Wednesday by the 2025 Lancet Countdown. Marina Romanello, Executive Director of the Global Academic Collaboration, says it found 13 of 20 health threat indicators had reached record levels.
And we're seeing things like extreme weather events becoming more frequent and more deadly. We have new data this year showing that we had more than 150,000 deaths related to wildfire exposure per year, wildfire smoke exposure per year. So the death toll of climate change is rapidly growing, and that is particularly concerning.
Air pollution from burning fossil fuels causes 2.5 million deaths every year, and people are being exposed to unprecedented numbers of heatwave days. Global transmission potential of dengue fever has also risen 49% since the 1950s. The stark figures come ahead of COP30 climate talks in Brazil. World leaders will focus on what adaptation measures can be taken before significant climatic changes exceed nations' capacity.
When it comes to health, we know that health is defined not only locally, but globally. So we need well-articulated global efforts to ensure that, firstly, we are adapting to climate change, and we're supporting all countries in strengthening our health systems to give a good response and reduce the threat of infectious disease transmission and other adverse health impacts of climate change through good health system adaptation. That needs funding, that needs knowledge, and that needs cooperation.
The report says oil and gas companies continue to expand production plans to 3 times greater than what scientists say the planet can support. Governments also spent 3 times more on fossil fuel subsidies in 2023 than they committed annually to tackle climate change worldwide at COP29. However, local governments and communities are leading efforts to address the crisis. An estimated 160,000 premature deaths were prevented yearly between 2010 and 2022 by shifting away from fossil fuels.